And then, yeah, I think there's a bit for feedback. So I'll get on with my bit because we've got quite a lot to cover. So next slide, please.
Next slide, please, Tracy.
They're moving on my screen.
They're not moving on the main screen for some reason.
No.
It's been a week of IT challenges for those of us in the local authority.
All sorts of problems in the local authority with our IT.
On my screen it's showing this. I'm not quite sure what to do about it now. Shall I stop sharing and start again?
Yeah, and then I could always share mine, Tracy, if you want, because I think I've got them as well. Oh, there you go. There we go. Yay. Right, so this is we show you the same slides every time, and that's because it's really helpful over time to kind of get a picture of how things are changing. So it's the same format, but obviously new data. So what you'll notice, and this particular slide is a good overview, starting in August and then going through to the present time. And you'll see what and this really is, you can see what difference lockdown makes, see what difference the tiers make, and then lockdown 3. So I think the sort of take home message really is that lockdown 3, we haven't seen those reductions like we've seen in previous lockdowns. That's probably for all sorts of reasons. One may be that a lot of workplaces have remained open. We know that people haven't been as adherent to the guidance as they were in the first lockdown. And also, you know yourselves, I know there's lots of traffic on the roads, lots of stuff going on. And sending children home isn't always a successful way of stopping infection rates, because those children, as particularly older age group, will often continue to meet with their friends outside of, just because they're not in school, they'll meet in their community. And also childcare, so sometimes family members are drafted in for childcare completely understandably, and that means that people are still mixing. So next slide, please. So again, just to show you the shape of the pandemic, and actually that last bit there, the bit to the furthest right, what we are seeing is that we're not seeing reducing numbers now, we're seeing kind of static numbers. So obviously with the snow, it's likely that for a few days people won't have necessarily accessed tests, and there'll have been a bit of a delay in tests. So we saw a dip, and now we're seeing a kind of increase. I think it was about 235, and then today, which is unvalidated data, but it's around 270 again. So not that kind of sustained reductions we were seeing previously. Next slide, please. So sometimes I talk about positivity. I don't do it every week. So the thing about positivity is, so for every 100 tests that we send off in Wakefield, how many of those are positive? And that gives us a bit of a sense of how many people in the district have got the virus, but also are we doing enough testing? Because obviously the data we have is based on tests, not based on actual cases. So if everyone chose to not get tested tomorrow, it wouldn't mean we'd suddenly seen a reduction in real cases. It would just mean we're not recording it. So you can see that the positivity has kind of moved up and down a bit, but again we've not seen it dropping down to where we'd like to see it, which is probably below around less than 5%. So yeah, next slide, please. So we keep an eye on ages, and that's because we get very, very worried about our older population. And I've got a brilliant new slide from the team who've just done me proud with this slide, which I'll come on to, that really, really demonstrates that so clearly. Lots of talk about school children, but actually if you look at that blue line, which is your 0 to 11s, really we're not seeing massive drops because schools have closed, and actually that line has remained more or less consistent, below the community transmission, but more or less consistent for months and months now. So just really need to sort of be careful how sometimes these scare stories start and they're not very helpful and they're not backed up by the data. So the line that we're really worried about, that we would worry about, is that the navy blue 75+ line and the orange 60 to 74 line. You can see that's gone up and down a bit, but again remains stubbornly high really. So that is concerning. Next slide, please. So again, just I show you this every time, I'm not going to dwell on it. Pretty standard, pretty much what you see every time. No areas that are particularly a lot higher than any other areas, and no areas, although Horbury's doing well, but no areas that are particularly lower. And as you know, this data changes quite a lot. You'll see every week it looks a bit different, and that's because we're talking quite small numbers. So next slide, please. So again, you'll know, because I talk about this every time, our biggest are really all quite worried about the hospital, and that's again that's not just about COVID. That's about the fact that any one of us may need hospital treatment. We don't know what's going to happen today. We don't know what's going to happen tomorrow. And if your child fell over and broke their leg, or your partner had an issue, a heart attack, you would want to be able to guarantee that level of care, which at the moment we absolutely can guarantee. But we know that if those numbers shot up and up and up and got to higher than they were in November, that it would put huge pressure on our system. And what we don't want is kind of ambulance call out times lengthening, etc. So you can see those numbers in a bed have gone up. Mid Yorkshire have confirmed that they are quite worried again. We really need to keep those numbers low. Next, and also remember there's a lag. Next slide. Anyway, so deaths, again, our deaths are staying around sort of 19 last week. But again, there is often a lag between any rise, but there is a lag between rise in rates. So I've said this before, but I'll say it again. We tend to see people worsening with COVID in the second week of the infection, and then a number of weeks after that is where that people are most likely to die of COVID. So I think it was initially 21 days. I think it's longer now because there's better treatment, but there is that lag, and that's why we need to keep numbers as low as possible now, so that we don't end up in a few weeks seeing those high death rates again. Next slide, please. Right, this is my personal favourite slide. Possibly ever, but definitely for today. The team have just produced this. So it's a nice colourful slide. The top line is the population. So that's what the Wakefield population looks like. So starting with your 0 to 4s and going up to your 75 pluses, which is the red line. The second line is your positive cases. So you'll see that we've had much lower case numbers in our younger population proportionate to the number of those people of that age in the district, and you'll see that we've had smaller numbers actually proportionate to age, just about of 75 plus, and certainly of 65 to 74s. But then if you look at the next line, that's hospitalizations, and you can see then the picture hugely changes, so that our 75 pluses, which are the red line, are massively overrepresented. So about over 55% of all our cases in hospital are 75 pluses, and then just trying to do that, I'm just trying to calculate how wide that the yellow bit is. But yeah, you can see that if you look at our if you start at the left hand side, almost no hospitalizations for our 0 to 4s and 5 to 11s. Almost none in fact for our 12 to 17s, but when you get up to 18 to 44, you start seeing those hospitalizations. Then they increase proportionately for your 45 to 64s and your 65 to 74s. And then if we look at the bottom line, which is the deaths, again you'll see how 70% of our deaths have been 75 plus population, and then another 20% have been our 65 to 74s, with a very with 10% being under 65. So I think and that's data from the 15th of November. So you'll see why the vaccination program is being so heavily geared towards older people and people in contact with older people, and it's just such a good slide, I think, just to demonstrate how COVID impact differs very differently across the population. So next slide, please. Right, I won't, if it's all right, we'll take questions at the end, just because I think we've got such a lot to get to. So I'll pass on to my colleague Emma to talk about vaccinations.
Hi everyone. So some will be familiar sort of with the detail around the delivery models for Wakefield, but presently we've got 5 collective groups of GP practices delivering vaccination to members of the population within the district, and these primary care network sites are based at Casford, King's Medical Normanton, St Swithin's Eastmore, Sandal Rugby Club and Churchview South Kirby. So everyone will be familiar with those. We now have hospital sites as well, which are at Pinderfields. Yorkshire Ambulance have a hospital hub site, and Swift have several hospital hub sites because of the nature of their geography, working with Barnsley in particular. And those hospital hub sites are more for the health and social care workers, as previously described. And then within Wakefield, we have a community vaccination centre, which is at Navigation Walk, and that has started to deliver vaccinations to members of the public, part of through the national booking system. So members of the public will have an invite through the national invitation process, and that will give them the details of how to book on, particularly for the community vaccination centre. And then we have community pharmacies coming online as well. So the one that is established in Wakefield is the Morrison's one in Dewsbury Road, but then there's another one in Pontefract that's established as well, and that's planned to go live in the couple of weeks' time. So that's sort of a quick whistle-stop tour of the site. Everyone will be familiar with this is the largest campaign that we've ever had, you know, even compared to flu, which is quite a big campaign. COVID is much bigger than that and reaches many more individuals than that. People will be very aware, as Anna's just said, about priority groups and who should be receiving their vaccinations first, because of the benefit to them as individuals in terms of their risk for severity of illness or even death. And this is why the campaign has been rolled out in this way. It's got vaccination has a long-standing history of safety and safety measures when we're producing vaccinations as well. And we just are seeing more and more information in the public domain about safety messages and vaccine messages in general. And we have information coming out now more in different languages, and that was slow to happen, but it's happening a bit better pace now, which is really welcomed as well. Next slide, please. Oh, we've got a little video. I'm not too sure if it's actually going to play. Let's see how we go.
I think it plays, but I haven't got sound on mine. I'm wondering if Sarah's available now to share her screen. Sarah?
Unfortunately, I've not managed to get it up quick enough. It's just taking a while to upload.
Okay, so could we maybe go past the video bit, and if we can get it?
I'll keep trying.
Yeah, there's no sound. So maybe if we could go past the video, come back, if we can get it going.
We can always send people the links directly as well if we've got contact details, or make them accessible in other ways, couldn't we, Kerry? I think this is obviously another video about patient experience, and this is really key, is trusted sources of information about vaccination. Really sadly, there are people there that are trying to scam people around vaccination and charge people, etc. The vaccination is absolutely free, and the invitation process is through national invitation booking process or the GP. And you know, if you're concerned about information that you've received that isn't genuine, then you can contact your GP in particular to see if it's true that you're invited at the time for vaccination. And then, you know, people are encouraged to report the scam information to the police, etc. So we'd strongly advocate using these sort of websites to get your information for the programme. I think that's the last slide on vaccination. So Kerry, are we planning to take questions now regarding Anna and my slot, or are we going to move through and take questions at the end?
Let's take some questions now about any case rates and vaccination operational delivery questions. There's none in the chat at the moment, and there's usually loads. So I'm just wondering if we've managed to cover everything to everyone's satisfaction. Surely not.
It was that last slide, Kerry. It was just so brilliant on every level. It's just stunned everyone into silence.
And beautiful as well.
Pretty.
Okay.
We like pretty slides.
We do. It looks like we don't have. Oh, hey, there we go. We've got a question from Health Watch. there's a question around outward surgery. I just wanted to ask if outward surgery are given COVID vaccination at the surgery as patients have been invited. So is outward surgery a delivery venue?
No, the individual outward surgery themselves as a practice won't be. They'll have come together with a collective number of practices and formed those the PCN hub sites. Apologies, my geography in my head can't work fast enough in terms of which site will be closest to outward of those that we've just listed. I'll have to come back to you once I get my head functioning to that.
Someone's written in the chat bar that St Swithun's would be the closest.
Yes, fab. Thank you very much.
That's fine. And we've got a question from Val. Would it be safe for furloughed staff to come back into work in the community after they've had both of their vaccination doses?
That's a really, really good question. So in terms of vaccination and benefits to the individual, so at the moment we know vaccination is of real benefit to you as an individual, and in terms of the severity of illness that you might experience if you become infected with COVID, and obviously the associated hospitalization or even death. So we know vaccine is very good at reducing that and benefiting you as a person. What we don't know is if the vaccine will help benefit in terms of stopping the transmission of the virus, and we're still looking at that evidence. So if you're vaccinated, that covers you in terms of the illness, but it doesn't necessarily mean that you can't cause illness to someone else if you are positive with COVID. So in terms of furloughed staff going back to work, staff could go back to work, but they need to still adhere to the current measures in terms of hand, face, current employer risk assessment for your employees, and all the necessary measures that exist now need to still exist even when people receive their vaccination. So I hope that's been helpful.
Thanks, Emma. Have we got some more? Is there a place to send details of scams relating to vaccinations? Someone received a text today which was clearly a scam.
We have had that link before, haven't we, Kerry? We had shared that in one of our other previous presentations. So I wonder, can we share that after this meeting?
Yeah, let's do that. Yeah. Okay, so we've got quite a few more slides to get through. So shall we carry on? And I know we've got a number of other questions that have been submitted in advance that I'd like to cover as we go through, if that's okay. So the next slides is around a new campaign that's launching this week called Careless Talk Costs Lives. So we'll be sending details of this out on the WhatsApp group and by email as well. Next slide, please. We're really aware that people, sometimes with the best intentions and sometimes not, could be sharing misinformation. So you can help break the chain of misinformation by checking that what you're sharing is from an official source. Obviously, everything that comes through these meetings is an official source, and we've listed a number of websites where people might be able to go to double check whether what you've heard is true. When we'd also encourage you to ask any questions within COVID Community Champions as well. If you do come across something that you know is fake information, you don't need to engage with it. Don't comment, don't share it further, because that just increases the likelihood of other people seeing it. Because of the way that social media works, the more people are talking about something, the more people see it, whether it's true or not. So we're going to be doing some campaign resources around that this week, and we'll be sharing some of that on the WhatsApp group as well as by email. Next slide, please. We've also got the Do It campaign, and Niamh, if you want to come in and talk to this, you're very welcome to. We're really keen that people understand that it's not just their own safety, it's for everybody in the community. So we'd like to, we're just reminding people that there's a real collective issue here, and that we're all protecting each other, as we've talked about lots of times in these sessions, as well as around vaccinations. It's not just your own risk, it's everybody. So we're asking people to tag us in posts about how you're keeping occupied at home, using the hashtag stay home, play home. So for those of you who are active on social media, we'd really like to see some of your exciting ideas this week. Have you got anything to add to that, Niamh?
No, I think you covered everything. Basically, it's just like a nice positive campaign for us to be able to share, because obviously we know that some people might be struggling staying at home at the minute. And it's just kind of, reiterating that it's really important to stay home, do it for your loved ones, do it for your critical workers, and also just to be able to share what you've been getting up to at home as well, so we can engage with that. So yeah, if you could share it on your channels, that'd be brilliant. Thank you.
And I think at these times, it's really important to have something cheery to focus on as well. It's a bit January-ish apart from everything else, isn't it? So, you know, anything positive that we can do to support people and give people some kind of positive distraction is very, very welcome. Thank you, Niamh.
Yeah, definitely.
Okay, we've had a compliment about the system in place in Castleford Civic Centre, which is great to hear, thank you. And some information about scans in the chat bar that we'll make sure is added to the feedback when we do the follow-up email on WhatsApp. So we've got lots of questions this time that have been submitted in advance. So I wonder, so we'll just go through them, and anybody who wants to kind of contribute can do. So starting with people who are deaf and hard of hearing, can they be accompanied by a spouse to their vaccine appointment as they need support with BSL? So I know we have had a separate meeting outside of this to talk about a range of needs of the deaf and hard of hearing community that we're following up, but more generally, can people be accompanied to their vaccine appointment if they need that support?
Yeah, from my perspective, yeah, you liken to carers and the support that they may need in attending a vaccination programme, and sort of this is another good example of where support is needed. I know there's some CCG colleagues on the call as well. I don't know if they want to add anything.
Yes, I mean, you're absolutely right. If a person requires support during the appointment, that is allowed. Obviously, we still monitor and make sure that everyone who's entering the vaccination sites are symptom-free, and we follow social distancing rules.
Brilliant, thank you very much. Is there parking at Navigation Walk? Is the information online? I can answer that. There is parking at Navigation Walk. It's in the Ruddy Duck Car Park. I'm assuming the information is online. Darsha, can you confirm that? Yeah, there's a link in the chat bar to the parking for Navigation Walk. So yes, there is parking there. I'm in phase 3 of the AstraZeneca trial. Do I still need the vaccination?
This is a really very good question. I don't know the exact answer, so I would ask the person that has asked that question, if they're on the trial, to go back to the trial colleagues that they have, you know, and the information there, and ask that question direct of them if it's not already in their FAQ information as part of the trial process, because there's different trials for different things. And I don't know if there's another colleague on the call that has that information further and associated with the trial.
Thanks, Emma. That's a classic case of that's not something we can answer here. It's personalised medical information.
Yeah.
Okay, when responding to queries about why some people have had vaccines not from the priority group, is it okay for us to say some have been done to save having to waste defrosted vaccinations? I know there's a protocol, Emma, isn't there, around making sure that no vaccine is wasted that's in the public domain?
Yeah, and I think the thing to say about this is just that with a programme of this size and this speed, and given the essentially we're in a crisis situation with COVID, that there are going to be times when it's especially with things like snow and events that you don't expect, where there's not going to be a perfect process, I suppose. So it would be impossible to absolutely line people up according to exact need and get that right every time. So if there are, so for example, if people, a good example was the snow, some people rightly so were offered an appointment a week later when the snow had finished, because what we don't want is people coming out of the home slipping, falling. So in that case, if literally no one else could have it, I think though that offer was made following obviously the priority process to give those to people, and I think some of that's then gone into the public domain and probably become a story about people getting it who aren't on the priority list, and that's not what what it is. I think the narrative is really about rather than throwing vaccines in the bin, it's better to give that vaccine to somebody. And I think it's just sometimes it feels like particularly the media almost hold people to this kind of ridiculous sort of level, but in reality what what the ultimate aim, the ultimate outcome is to get every single adult in the population vaccinated as quickly and effectively as possible. And inevitably that will mean that sometimes there are slight sort of flexibilities, particularly when there's unexpected events like a snow. Well, I don't know if you could say unexpected, but events like a snowfall, for example. I don't know if anyone else wants to add to that.
No, I think that covers it really well, Anna.
Thank you. Question about pharmacy staff who are classed as frontline workers. We've heard nothing about our jabs. So I know that there is a piece of work going on to map people who might be entitled to vaccinations, and that there's increasing guidance coming out frequently. Emma, do you want to answer this question generally?
Yeah, I can answer this. So all pharmacy in Wakefield district have been contacted, and they've asked each of the pharmacies to identify the staff that are patient facing within those settings, and they will have access to the vaccine, and that's been done through our Wakefield CTG colleagues, that invitation process. So I think it's probably just maybe a time thing from when they've had this experience to when that information's actually landed with their employer as a pharmacy and been relayed to them, hopefully as an individual. But if that hasn't been their experience and it still is a gap, I would just ask them to go back to ask their pharmacy employer to see when they will be able to have their vaccination. But certainly if they're frontline pharmacy staff, they are eligible for vaccination.
Thanks, Emma. Moving on then, there's a question about the carers of loved ones in care homes and whether they will be able to receive their vaccine.
So this is carers of loved ones. So their loved one is in a home, but they're a carer and they want to go in and visit. So carers are on the list for the JCVI criteria in terms of vaccination. So if they're a main carer, then they will be eligible. I think this is a really challenging one, isn't it? Because necessarily if their loved one is in a care home, they themselves are not necessarily a carer for that loved one, but they may be a carer for other means or for other family members, so they will be eligible. Having your loved one in a care home, unfortunately, doesn't really mean that you'll automatically have a vaccine yourself because they are placed in a care home. If you are falling into any of those other priority groups, so let's say for instance you're yourself are 70 or younger and in a clinical at-risk group, when the programme is rolled out for the general population in that way, you'll be eligible there. But having a family member in a care home doesn't make you directly eligible for vaccination.
Thanks, Emma. It's a really difficult situation for families. We really do understand that. It does lead on to the next question, which is about carers for people who are housebound and receiving their vaccinations. So there's two parts to that question. One is, when do we have a timescale yet for when people are housebound will get their vaccination? I don't know if you've got an update on that, Emma.
Yeah, so the CTG and GPs are working very hard on this, and this is already underway within the Wakefield district, and I think there is an ambition sort of within the next 2 weeks we'll start to see that programme mobilise at pace and speed. So hopefully more and more people who are in the housebound situation will be receiving their vaccine in the coming weeks ahead.
Okay, and again about vaccines, if the GP is advised that you can't go to work, I think that's specifically around a personal assistant who may or may not have been picked up in the first round of mapping for personal assistants, Emma. But I believe that mapping for people who are maybe not employed by the local authority or maybe employed elsewhere in order to get their vaccination in a priority way. Is that how you're reading the question?
Sorry, I need to process. So we currently have a PA on furlough until she has had the vaccine, but her GP has advised her to wait her turn. Yes, so the personal assistants are part of the rollout for the vaccine, and it is just a matter of time for when they will be given that opportunity. She doesn't understand why carers from care companies are able to get the vaccine, but she isn't. Any other suggestions, please? I think this is just a natural mechanism. It's that we have to start somewhere first with the vaccination programme. and sort of carers that are working for organisations potentially are working for multiple families, and that's sort of the rationale as to why they're sitting in the frontline social care staff, and then there's obviously the PAs within that group as well. So it's just a matter of time. I would just add some context to this. I think it's really helpful. If people think of the flu campaign, the national flu campaign starts in September and finishes in February. It's a big campaign in its own right. Got a lot of groups in there, and the system is also delivering healthcare. The COVID vaccination just kind of came into start in December, and we're now sort of maybe 6 to 8 weeks in that phase as part of that national rollout. And what we've achieved in that is phenomenal, and the pace of that is phenomenal. And the ambition to have everyone, vaccinated, by the autumn. When you think of that, that's sort of what, seven months. So that's not too many short of the national flu campaign for such a whole bigger cohort and 2 doses. I think it's just a matter of time, and we just have to be patient. And I know that's really difficult, but it is a matter of time, and ensuring that we roll through the program as quickly as possible to those people that are on those groups, working towards that ambition of everyone over the age of 18 having a vaccination by the autumn.
Thanks, Emma. It is really difficult. I know everybody's so desperate now, aren't they, to get back to normal and get the vaccinations, and it's just unfortunately not that simple or that quick. So I'm proposing, we had hoped that we have a little bit of time to ask people about their information and experience, but we've just gone over time. So I'm just going to take one more question from the chat bar before we close up, and ask if people do want to share any feedback with us, that they do either in the chat bar or or send us an email or a WhatsApp. There's a question around the early years sector, and whether they will be eligible for vaccinations, whether they're being considered for priority, especially given that some of the nurseries are providing childcare for key workers. Emma, do you know if that's being considered, or if we need to add that group to the list?
Yeah, so at the moment, early years settings aren't within the JCVI criteria. They're looking at the evidence and the basis all the time. So, those decisions are always ongoing, but at the moment we're working to the criteria we've got to. I think it's the latter part of that question I just particularly want to pick up, again, to just reinforce the message around vaccination. Vaccination is really good to you as an individual, but not about controlling infection within the setting. So having your workforce vaccinated doesn't necessarily mean that you won't have workforce with positive tests needing to self-isolate and needing for you to take out the necessary actions. And I think that's really important, that we help people understand that as part of this process as well. It's a 2-phase sort of step. Vaccination is good for you and your health, but doesn't stop sort of the other measures if you have positive cases within your setting.
I think the other thing just to say on that as well, is that the first phase of the vaccine is about preventing deaths, not business continuity. So staff that are getting vaccinated are staff that are in contact with vulnerable groups and older people. So once that first phase of vaccines are over, which we're seeing now, we've been told that there'll then be a second list once all of those people have been done, and that second list is going to be more about business continuity, and we can definitely advocate. We've been told local areas will be able to advocate for groups. So as you can imagine, there's quite a lot of people who want to be on that list, but we will be able to advocate. And obviously early year settings are a key setting, not least because of the support they give to key workers, but also because we know for children it's such a vital, that 0 to 5 is absolutely vital, and if children miss out on that, it has a lifetime impact. So we will be sort of advocating for that.
Thanks, Anna.
Brilliant, Anna, thank you. I think that sums up really a lot of the questions that we've had about vaccinations today and over the last few weeks, so thank you for that. I'm going to close the session now because we've just gone over time. We will be holding a longer monthly session next week. So if people want to join that, you're welcome to do so, and there'll be a little bit more time for questions and answers during that session. We are having a bit of a theme and a presentation around mental health as well, and we hope to talk a little bit about the local testing service if we're able to match up diaries. So thank you very much, everybody. Keep safe, and I look forward to seeing you next week.
Thanks.
Thank you.
Thank you. Bye.